yesterday
Ma'am,
instead of
yeah,
yesterday.
isn't the okay session is recording? Yeah, right.
Yeah, it would
Okay,
be. You started from the college.
okay.
Okay, fine. We'll start till others join. Otherwise, it's waste of time. Ne? Okay, so you all were given an activity to do. Shall we do that first? Shall we discuss it? Yes, anyone would like to explain your example?
Ma'am, excuse me.
Yeah.
Shall I call them and see, ma'am?
And yes, like if you can just put the text message or drop a message, kind of that, it also fine. If you can, please, yes.
Yeah, I dropped messages, but some of them are offline.
Oh, okay. Then if you can just call, ring them and see.
Oh, okay,
Okay,
ma'am. Okay.
thanks, Iba. Okay, what about the
Okay, it's
others?
okay, ma'am.
Ma'am,
Yes.
uh, I'll be taking the incident of a dog chasing a person.
Uh-huh.
At
If
first,
not, can you speak a little bit of loud? It's not clear for me.
okay. Uh, Ma'am, now can you hear?
Yes, can. Manageable.
Okay, I'll be taking the incident of a dog chasing a person. Uh,
Mm-hmm.
at the first, the person sees the dog and hears the sound.
Mm-hmm.
Then, sensory organs detects the sound, and then through peripheral nerve system, the message is transmitted to the central nervous system.
Okay.
So in central nervous system, brains from the lobes, it identifies the sense. That means from occipital lobe and frontal lobe, the vision, and the from temporal lobe, the sound.
Mm-hmm.
After that, the message transmitted through motor nervous to the
Mm-hmm.
to the legs, and that means from autonomic nervous system, that means the shivering and the
Yes.
release of adrenaline hormone
Mm.
and the heartbeat, that kind of things um, done. After
Mm.
that, at the same time, from the somatic nervous system, the person tends to run, and
Yes.
because of the action of that,
Mm-hmm.
uh, that's all. Ma'am.
Yes. Good
Yeah.
example. Yes. Good.
Okay. Thank you. Okay.
Yes, others? Yes, what about the others? So this was supposed to discuss on Wednesday, Thursday, girls. Yes. Yes, Nadia.
Uh, Mosquito landed on my hand
Mm-hmm.
and it bit my skin, so I killed that mosquito. And mosquito land my central, peripheral to central nervous system, and response comes to again peripheral nervous system,
Mm-hmm.
and after that somatic nervous system and autonomic nervous system is going. Is it correct,
Mm-hmm.
madam?
So
And after that,
mosquito landed on your hand. Okay. So
oh,
once the mosquito landed, I mean, how you collected the information, sensory information, how that was collected? Yes. Now once you did you see, did you feel it? How? Did you hear that? How?
feel it.
Are you feel it? Didn't you see the
Yeah,
mosquito at that moment?
yeah.
So both informations are there. You
So,
collected the sensory, sorry, visual information and also kinesthetic information because you feel that. So then you collect both the information from the peripheral nervous and the visual information from the peripheral nervous in the eyes. එතනින් දකින්නේ. And the kinesthetic information taken from the skin. So all the information is taken from the peripheral nervous system, it goes to brain. Then only from the brain, so the occipital lobe, especially like it decided, okay, this is a mosquito. So this is not a fly. The fly කෙනෙකුට අපි තටස් ගාලා ගහන්නේ නැහැනේ. fly ව එළවනවා. But for the mosquito, we definitely slap on us. So then from the occipital lobe and visual processing, information processing, it's decided, okay, from the past memory also it's been function at that moment. So from the past memory, we decided, okay, so this is not a fly or anything, it's a mosquito. So then what I supposed to do for the mosquito is, so then I mean the thinking. හිතනවා ඊට පස්සේ දැන් මම මොස්කිටෝ කෙනෙකුට මොකද කරන්නේ? බලාගෙන ඉන්නවද? නැත්නම් ගහනවද? නැත්නම් පිඹිනවද? What shall I do? So then it decided, okay, you have to hit on it. ගහන්න ඕනේ කියන එක. Then it goes to ගහන්නේ මොකෙන්ද? කකුලෙන් ගහන්න බෑනේ. So you use your hand. So that information goes to your hand, limbs, and then you take the action and does it. But sometimes some people, they really get scared and sweating and increasing their heartbeat and all. So then they they hit the mosquito as well as, and they get the rapid heartbeat also. Right? So autonomic somatic දෙකම එතකොට involve වෙනවා. That's how you want to explain it, okay?
Okay.
Right. Yes, others?
Ma'am, may I?
Yes, sure, Jazeera.
A person suddenly fallen down from the staircase or steps. Then the sensory experience is shouting or scream like that. So it's peripheral nervous system to central nervous system, and that
Again,
brain
from the
recognizes
beginning, person
fallen down from the staircase.
Okay, one person had a fall from the staircase. Okay,
Yeah.
then
He's shouting. Of
he
fear.
screamed. Okay.
Yeah, scream. So the sensory experience that, and peripheral nervous
What is the
system to
sensory experience? Fallen, the screaming, the what?
yeah, fallen.
Fallen. Okay. So then
Peripheral nervous system to sensory nervous system, and the brain recognizes that
before go to the peripheral
have
nervous
to walk
system,
up, no?
once no wait, Jazeera. Before go to peripheral nervous system, I mean now
Yeah.
the person had a fall. Yes.
Yeah.
So I mean after falling down, what is the sensory experience and from where the information is collected? එක කියන්න ඕනේ peripheral nervous system එක කොහෙද තිබුණා? Now I
peripheral nervous system.
mentioned here, listen. I mentioned when the person saw the mosquito, I mentioned that the visual experiences, visual information collected from eye nerves. Sorry, නැත්තම් visual vision එකේ තියෙන nerves, from the eye nerves, the information collected and taken to the sensory central nervous system. So you want to mention what kind of peripheral nervous system? Nerves in the legs, nerves in the knee, the nerves in the hands, the nerves in the head, where?
In legs, man.
Yes, explain it
Anything.
again from the beginning.
A person had fallen down. The sensory experience is in nervous from leg.
Hmm.
Is that okay?
Okay,
So
so then
the
from the right, so then you had a
experience was
fall. So then from the peripheral nervous system, peripheral nerves in the legs, it goes to
yeah,
the central nervous system.
yeah. Then have
Then
recognized that he have to work up, no?
he have to,
So again work up.
okay.
Again peripheral nervous system and
Where the peripheral nervous system goes to?
leg.
මතක කියන්න ඕනේ. Again?
So again he took the leg and
Hmm.
somatic nervous system
Huh.
and now
So
he's
from the
free.
somatic nervous system, what does it do?
It means
From the somatic nervous system, what does it do?
it
Now you
control
said
this.
from,
Yeah, it control the skeletal muscles, no?
control the
Skeletal muscles.
skeletal, okay, muscles. I mean, it goes to, it collects the, sends the informations to muscles and bones and all. Okay. What is the message?
Message to walk up,
Get up, right? Okay,
get
message to
up,
get up.
get up,
Then
and then he's okay, he's free.
Mhm.
So is parasympathetic nervous system.
What does parasympathetic nervous system do?
Nervous system, it means freeze, no? It converts energy, maintain.
Mhm.
So
So
now
even
he's
like
okay.
once I mean, did the person get freeze in your example?
Yeah, finally he get up and freeze. He'll freeze.
Freeze.
Yeah.
The
So it's
freeze වෙන්නේ බය වුණාම does it get, I mean, the scared or frightened or whatever in your example?
he's scared.
He got scared. Okay.
Yeah.
All right. Okay.
So freeze, no?
Mm-hmm.
It's parasympathetic nervous system.
Yeah, listen for the other examples also properly. Okay.
Okay, ma'am.
Because like
Yeah.
it doesn't mean like when you're explaining an example, it doesn't matter මේ system එකට එහෙම නෙමෙයි. It's not like that. I mean, there should be the flow up. So even when I explain the examples, just be mindful about it and listen. Okay. Right. Any
Okay, ma'am.
others? Yes, Mirsana. Yes, please come across with the examples quickly because we are running out of time. There's no point of waiting. So what about the others? Now only two of you all shared the example. Beenat?
Ma'am, I said last time,
Yes.
right?
Yes, Zainab, you said. Who else? Yes, Nadiha.
I said when.
Did you say that? Okay, sorry.
Yeah.
Even I said
Hiba,
last time, ma'am.
who else? I mean, did you all explain it last time?
Yeah, I did
Yes,
it
ma'am.
last time.
Okay, so then, right, we'll go ahead with, have to continue some more neurotransmitters. Ne? I think we discussed only acetylcholine and serotonin last time. So today we can discuss dopamine, right? So dopamine also one of the very, very important neurotransmitter. Um, because dopamine plays an important role in movement, attention, and reinforcing. Reinforcing is the very, very important thing to be
Excuse me,
energized. Yes.
Miss. I couldn't attend last two classes. Can I know which PDF you are doing now so that I can continue with it?
This is related to with the not the latest one before the latest one, where I did the nervous system and all, brain and nervous system. There I mentioned endocrine system and left a space for hormones and neurotransmitters. So I'm
Oh,
explaining the hormones and neurotransmitters.
okay, so we in that PDF, this that is not mentioned, right? The
It's not
details are not.
mentioned, so I hope you all can get the record, so then
Uh,
you can get the record as well. But if you can share with some of your colleague also, then you can get the document. But if you
okay,
have any questions, you can ask.
sure, Miss. Thanks.
Okay,
Okay.
right. Why I didn't give the note is because this is something extra. This is extra knowledge for you all. And the other thing is like there are so many things. I mean, but I'm telling you all very important points. That's what I thought of. Okay, I'll verbalize it. Then you can just write down here. Right. So the dopamine is another important neurotransmitter. So it is control the movement. It plays an important role in movement, attention, and reinforcing. So reinforcing in a sense, and for the dopamine, it says a happy hormone කියලා කියනවා. Right? Because once like dopamine makes us happy. Reinforce කරනවා කියන්නේ it stimulates us. Right now from here, I think I mentioned even when I was talking about previous lessons, kind of that alcohol and drugs and tobacco and all. So all these things, narcotin, tara and lithium, alcohol, all these things, chemicals, once we taken to our human body, it goes to the I mean it directly mix with the bloodstream, and then when the blood flow when the blood flows up, so I mean when the amygdala reach that this kind of blood, so the amygdala gets stimulated. So then once amygdala gets stimulated, so then it gives a kind of the signal for the neurotransmitter nodes to secrete the neurotransmitter of dopamine, right? So the dopamine is related with pleasure and happiness. Okay. So when the dopamine is low, when this dopamine secretion is low, so then we don't feel happy. We are being in very blank mood, and also like no feel of entertainment. Whatever we do, we don't feel much kind of entertainment. Sometimes we don't feel to go out and have fun with friends, but that is something we used to do, but now I don't feel it. Because why? My dopamine level is decreased, right? So then we do say, okay, these features are called, the sign of depression. or you are stressed out. So obviously when we check if we go for a chemical test or something, so then obviously with the depression people and stress and sometimes anxiety, their dopamine levels are really low. Right? Is it clear?
Yes.
Right. Okay. So there is another one, epinephrine and norepinephrine. Yeah, I hope you all could remember in the hormones also we talked about this epinephrine and norepinephrine. Can you all remember?
Yes, ma'am.
Yes, adrenaline and noradrenaline විදිහට තමයි කතා කරේ. So this one, same thing, works as a hormone and also a neurotransmitter. Right? Epinephrine and norepinephrine, they work as a hormone and also work as a neurotransmitter. Just remember like that. So when it comes with norepinephrine, right, it involves in emotions and alertness. Alertness in a sense, adjusting, adapting to the situations.
Ma'am,
Yes,
epinephrine and adrenaline, they both are the same, right?
same.
Okay, ma'am.
They both are work as a, hormone as well as the neurotransmitter. Right? So the norepinephrine involves in emotions and alertness in a sense adaptation, like adapt to the situations. Now, for say an example, adaptation in a sense, like you see the fire and you really scared, and then once you collect the visual experiences, visual sensory experiences, the picture of image of fire, and it goes to your memory, and then you recall your memory, and you might go ahead with past incidents. So then that makes you really stressed out, so your parasympathetic nervous system tells makes you like freeze and kind of that, and like you are being kind of to the moment, like you are not in a position to flight or fight, something like that, right? So at the moment your heart rate is really high, kind of that. So but with the some time, within the sometimes, like you get adapt to the situation, and sometimes you take some kind of a necessary actions related to that. That means you adapt yourself to the situation and control your emotions. Okay. And the epinephrine is, as a neurotransmitter, the role of epinephrine is, it is kind of an energy boost. Energy boost for, supply oxygen and glucose to the brain. Right? As a neurotransmitter, hormonal factor ka venas, okay? As a hormonal, it's another role, but as a neurotransmitter, epinephrine, it works as an energy boost and supply oxygen and glucose to the brain. Right?
Ma'am,
Yes.
you said that norepinephrine, it is an alternate. So that means the people who are living near that place and all, they are adapted for that smell. And likewise, is it?
Yeah. Yes. They adapt to the situations. Ne?
Okay, ma'am, right.
Adaptation, then I even adaptation in a sense, the stressful situations, if the person, if it is something made you uncomfortable, but now we are being adapted to the situation, so that happens because of norepinephrine neurotransmitter.
Okay, ma'am, right. Thank you.
Okay. Right. So GABA is another, GABA is another neurotransmitter. from GABA hormone, it controls anxiety. Right? And also it decreases the likelihood. I mean, sometimes, appetite lose occur. So it decreases the likelihood. Whatever you likelihood and whatever you really pleasure to do, pleasant to do, kind of that, it increases your likelihood also, and also it controls your anxiety. Right?
Excuse me, ma'am.
Yes.
Ma'am, what is the third function?
Third function,
Yeah, now what you
control
told.
anxiety and decrease the likelihood. That's it.
All right, okay.
Only two functions. So the one last neurotransmitter is glutamate. So glutamate involves in memory and increase the likelihood. Right? So ඔය ටික විතරක් මතක තියාගන්න. Just you remember the names, because why I mentioned that. So the next point is mental issues. So then once it goes to anxiety and depression, kind of that. So you really want to have some kind of an idea what the depression made. Then අපි කියනවානේ for the depression, we have to go for a, it is counseling is not enough. You have to go for a medication කියන එක. So now once these neurotransmitters and hormones imbalances happens, I mean, we have nothing to do as a counseling. As a counselor, we have nothing to do, because by talk therapy, we never can increase or decrease the chemicals. I hope you can understand. I mean, it is clear that, I mean, it's a clear factor for yours. Because sometimes still this happens, because sometimes that people do say no, counseling is enough, go and talk to somebody, so then it's fine, Kenya. And they're reluctant to go for a medication. So if, like, now you know what is the nature of happening behind these situations. The thing is the chemicals are being imbalanced. So obviously you want to go for a psychiatric and get the medicine for this imbalance, to make the imbalances to the balance level. Right?
Miss,
Okay.
excuse me.
Yeah.
Now, as you're saying this, so like dopamine example, it is like a happy hormone. So now, say someone is like sad and they're not interested to talk to anyone. So it is because of lack of dopamine. So if this
Yes.
person goes to counseling, is if they come to us, so is it that we can do some therapies, right? We have so many therapies and techniques. We can do that and do without giving medicines also, right, miss? So
No,
is it that?
can't.
Mm-hmm.
Can't. How can we give the chemical imbalance කරන්නේ කොහොමද?
There's therapies, no, for one therapy. So in that it won't work out.
No, can't. That's what
Mhm.
I'm telling. Because so many counselors, they do like that in Sri Lanka. We can't do that. That whatever the behavior happens because of this imbalance. So
Mhm.
now, just an example, I'll tell you all. Like, හිතන්න funeral, right? That particular person, and we take Anne. So Anne's father passed away. So even mother had passed away some times ago. So only parent whom he had lived with her. So he also passed away. Right? It is a great shock for Anne, because parents, I mean, father is his one and only person whom lived with her, and also like now he is no more with her. She had been attached to a father, like that. So it's a great loss to Anne. So Anne is obviously sad. So after the funeral, so she gets some thoughts. No one is there. I'm all alone, right? So now father is no more, and no one is there to take care of me. I'm lonely now. Like that thoughts. Even thoughts name is the lead passe. So and then thoughts to take her. So then she feels sad. She feels sad, and sometimes she worry about her life. So or feelings of kumena. So then because of that, so once these thoughts comes out, right, it's a thought cycle. So no one is there for me. I'm all alone. I'm lonely now. කියන එක මුළු පැය 24ම හිතනවානේ. So ඔය thought process එක our in our human mind, so whatever the thought, so it is kind of a circulating process. So ඔය thought එක හැම වෙලේම හිතනවා. සතියට පාරක් හිතනවා නම් no problem. අපි හැම වෙලේම දුකින් ඉන්නේ අපිට ඒක හැම වෙලේම හිතන නිසා. So it's
Excuse me,
all
ma'am.
over circulating within ourselves. So once it's
Excuse me.
circulated, what will happen? The thought කියන එකත් එක්ක, so then it affect to our hormones. So then what can happen? So then like within the thoughts, it affect to the hormones and the now we got the
Ma'am, excuse
neurotransmitters
me.
and hormones. Yes. Yes.
Ma'am, Salma is saying that for you to accept her request.
Ma'am, Salma lost the
Hello, ma'am. Can you
connection.
hear me?
I can hear you. Yes, it's okay. Yes.
But she is also losing her connection. Salma
Yeah.
said for you to accept her request
I
because
accepted.
I mean you are not letting it in. Okay, then fine. Please.
Okay. Right. So once the thought cycle is circulating continuously, it affects the neurotransmitters and the hormones. So then, I mean, according to the thought process, so some serotonin level would be increased. The dopamine level would be decreased. So once the dopamine level decrease, we don't have that happy emotions. So then our emotions are changed. So then we are sad. We get all the negative thoughts, not in a mood. So there is no anxiety control and there would be sleeping problems. So all these emotions and the behaviors are happen because of this, our thought and also our chemical imbalances. So we need to give the medication for the chemical imbalances also. Because it's already happened in a sense. Now, I mean, from the receptors, it increased, I mean, it released a lot. Now, for say an example, tap එකක් ගන්න ඔයගොල්ලන් ගෙදර තියෙන. So tap එක දැන් බටයක් හරි once it broken, can we stop it? නෑ ඒක continuously යනවා unless we put some pressure and we put some gum or something or some kind of a loop inside it and just මේවා කරේ නැත්නම් unless we close it, the water flows continuously. So that's what we have to do. We want to close the receptors. Because in our chemicals and neurotransmitters, I talk about when I explain the nerves, the image of the nerve at the end of the dendrites, there are synapses. So each and every synapses, there are some receptors. Receptors are like windows. එතකොට usually normal level එකේ යද්දි windows පහක් කරනවා නම් once we stress out, so then there would be like 10 or 15 windows are open. So once more, I mean, once there are so many windows are open, receptors are open in a sense, the more chemicals would released. Then our body adapted to that situation. Our synapses adapted to that situation. So unless we give some medicine to close the receptors, that is what the medication does. Through the
So
chemical
Miss,
medication, they
excuse
close the
me.
receptors.
Excuse me.
Yes.
Miss, as a counselor, we are not allowed to give medicines, right? So we have to recommend them to a psychiatrist. So as a
Yes, yes.
counselor, what is our role to this person who has this lack of dopamine? What is
Okay.
our role?
So I'll explain this and come to this point because my explanation is not done yet. So
Okay.
I mean, from the medication, what do we do is like we close the receptors. We close all the unnecessary receptors. That's what the medication does. So that's what I'm telling, that medication is very important because through counseling we can't close the receptors. We can only change the thoughts. So the stress people, once there is a next module will be doing the stress. So especially acute stress now. So I mean there is no point of going for medication kind of that, because counseling can do, because it is at the initial stage. But once it comes to the symptoms, whatever the symptoms we are having with, when it goes beyond a month, that means it is not in the acute initial stage, it has gone to a second step. So then definitely we have to go for a psychiatric and do all sort of things related to the neurotransmitters and hormones, and parallelly counselor or the therapist can do the changes of thoughts. So it is the job of role of two people, not only the counselor. Right? So as a counselor, I mean, then නිකං counselor කෙනෙක්. දැන් අපි ලංකාවේ ඇත්තට මෙහෙමයි කියන්නේ psychological counselor කෙනෙක් නම් counseling psychologist කෙනෙක් නම්, so then that person is really expert in so many therapies and all. Right, there are very මේ ලංකාවේ හරිම අඩුයි. There are very few මොනවාද counseling psychologists ලා. So and the psychotherapist also. හැම counselor කෙනෙක්ම counseling psychologist කෙනෙක් නෙමෙයි. Counseling psychologist කෙනෙක් වෙන්න නම් you have to do a basic degree with psychology and counseling, and then you have to, second step, you have to I mean the masters in the field of counseling. Then only you can be the counseling psychologist. With the basic degree also can't do, because from the basic degree we never mastered in the specialized in any field. Specialization is done in postgraduate studies. So then once you are specialized in counseling psychologist, so there are lots of other techniques, and if you are a psychotherapist, even counseling psychologist don't have license to do the testing, IQ testing, personality testing, psychological testings. So psychological testings can be done by a psychiatric or clinical psychologist. So only the counseling psychologist can do the therapies. Parallelly, the medication is going on with the guidance of the psychiatric, with the guidelines are given by the psychiatric. So with that, so the counselor do the talk therapy. කියන්නේ ඒගොල්ලන්ගේ thoughts වෙනස් කරන එක. දැන් receptors ලවට thoughts වෙනස් වෙන්නේ නැහැ නේ. thoughts එහෙමම schemas වගේ ඇලිලා තියෙනවා. So counselors part is the talk to them and help them to change the irrational thoughts of them and make them relax. Yes?
Ma'am, can we follow the therapist degree without psychology degree?
No, can't.
Can't, right?
Basic degree is BSc in psychology and counseling, or BSc or psychology degree. Other than that, can't, because you want to have a basic knowledge. So in the BSc in psychology field, we talked about different fields of psychology. counseling විතර දැන් ගොඩක් ගත්තාම ගොඩක් තැන්වල මාස 6-7 counseling course කරලා මිනිස්සු counseling කරනවා. ඉතින් counseling කරාම I mean sometimes they don't know, because to be a counselor it is not just listening. I think I explained it from when you are doing the counseling practice also. Counseling is not only listening. It is not only listening, it is to understand the situation. To understand the situations, you really need to have the very good knowledge about brain function, how the brain is function. So everything is related to the brain. How these hormones are function, how these neurotransmitters are function. So once the client says some kind of a story, so if you really good in that knowledge, you would be able to create a map of the person. Okay, then මෙයාගේ තියෙන්නේ මොලේ මේව තමයි secrete වෙන්නේ. මෙතන අඩුයි, මෙතන වැඩි. So making, then you will be able to, if you are a very qualified person, you will be able to gauge the future events also. දැන් මේකත් මෙහෙම ගිහිල්ලා ටික දවසකින් හරියට බෙහෙත් ගත්තේ නැතුනොත් මෙතෙන්ට යනවා. එහෙම knowledge එකක් කොහොමද මාස 6-7කින් ගන්නෙ? So now even you all are doing the 6 month Neogolan course. This is 6 month, right?
Yeah,
How long is your course?
6 month theories and other 6 month
Month
training.
practical.
Yeah,
Okay,
yeah.
so theory is 6 months. Right, and 6 month alla thama. So I'm telling you all, it is just basic thing. Just keep it in mind. Kalau tahu kochra drop කරලා තියනවාද? නේද? So I mean there are a lot to study. So even like if you all are, I would say please don't think this one is totally enough for you all to go and practice. Not at all. So this is just a basic knowledge for you all to go for a degree.
After HND, can we work as a counselor?
I don't recommend it. What I recommended is, especially as a person who is in a Sri Lankan Psychological Association and who are working for a licensate, I really disagree with that. And I don't like when people are practicing like that. Because there are lots of people who committed time, committed money and studied a lot and doing their masters, specialized and come and do the practices. එහෙම වුණාම අර අවුරුද්දක් දෙකක් චුට්ටක් ඉගෙන ගත්ත ළමයි practice කරාම මොකද්ද? I mean like I hope you can get it, right? Because obviously you can't gauge the knowledge like a person who did masters after doing 1 or 2 years. Because you have only half of the knowledge. You all haven't gone for the hospital practices or whatever, and also haven't done any researches related to these people. HND researchers just giving a basic knowledge. So if you really, the way I recommended, and I really hope that you all also some of my, even in your first year, you all are kind of a students of mine. So I hope you are also going in the right way. So this is just even HND also just a kind of basic knowledge for your degree, and so get the degree and then find out, even like when you go for a degree, you will be able to find out several paths. The psychological and counseling psychology it's a vast area, so you will be having so many fields. So you can find out which field is really interesting for me. Then you can go and specialize, and of course you are qualified with the person, qualified to the field, and so no doubt, no one is going to point out you then, and you are also for your heart conscious, and you are also really like you don't also getting not getting any guilty feeling. Something is that something that I'm doing wrong or what kind of that, because you know the knowledge, you know the people, you had experiences, so you know you are doing the right thing to the society.
Ma'am, excuse me, ma'am.
Okay. Yes. Yes. Any questions? Exam. Okay. One of you all asked like, want this come to the exam? But whatever the things I discussed, like at least when you talk about kind of depression or if you mention these things, right? These are the extra true knowledge true factors. So if you mention those things, I would give extra. You will be getting more marks because those are, the extra knowledge and extra informations. Okay. Right. Any questions so far before starting our next module? Yes, any questions?
No, ma'am.
Right. So the next module is next unit I taken is the social issues and the mental illnesses. Yeah, yes, social issues and mental health. Mm, so under that, we talking about very first, not the social issues. We'll keep the social issues later, right after discussing this. So from the mental health, okay, so we'll start with stress, right? The mental health කිව්වහම these are the common disorders. I have given only few. මෙච්චරක් විතරක් නෙවෙයි තියෙන්නේ. This is only few common disorders where we can find. There are lots of other things, but I mentioned only the major parts, right? So the common factor is a stress. නේද? දැන් හැම වෙලේම like even in this pandemic situation also we do say I'm stressed out and I don't know what to do එහෙම කිකි කියනවානේ, right? So the stress is one kind of a main thing. What do you all know about stress? දැන් මේක කියවලා කියන්න එපා, right? Just tell me, have you ever experienced stress?
Yes.
Yes.
Yes, okay. Yes, we can never say no, stress is very novel thing to me and I haven't gone through stress කියලා කියන්න බෑ. Because sometimes අපි දන්නෙත් නැතුව අපි දන්නේ නැහැ that I have been stressed කියලා. ඒක සමහරවිට අපි stress phase එකේ ඉඳලා තිනවා without knowing also. And stress is nothing shame to say anything. Even that I was a patient of depression කියලා කියන්න nothing to be shame. There's nothing to be shame. ඒක ඒ ස්කීමා එක ඒ what is it called taboo එක it's I mean still they are in our society. People do have such schemas like they're reluctant to say they're reluctant to talk about mental illnesses especially. I think I shared one experience also like with the hospital where I used to work. Did I tell you all that people used to come from tiny gate without coming from the main gate? කියන එක? I think I told you all.
No.
So, I mean, at the hospital, like for our unit, it is not mentioned as a psychiatric unit or something. There was a nice Sinhala name. I can't remember the name, but that unit was very close to the main gate of the hospital. හැබැයි අර මිනිස්සු කවදාකවත් එතනින් එන්නේ නැහැ. එතකොට අර main path එකෙන් ඇරලා හැරෙන්න ඕනනේ unit එක පැත්තට. There's another tiny gate at the back side of the hospital. So they used to come, most of them, they used to come from that gate because no one can see them. That is the social schemas that they have because they are having some kind of a thoughts that others would judge us and we would be labeled as a mental illness people, kind of that. Not at all. Then අපි කවදාකවත් do we get kind of bad thoughts kind of that related to the cold and fever? උණ හෙම්බිරිස්සාව නෑනේ. බේත් ගන්න යද්දිත් if somebody ask where are you මේ උණට ටිකක් බේත් ගන්න යනවා කියලා අපි කියනවානේ. If somebody come and ask okay where are you all going, we don't reluctant to say that I'm going for the doctor. I would say no, one is having fever, so we are going to take some medicine කියන එක. But for this mental illnesses, yes, we do have still. And even corona also the same, ne? Yeah, people do having such kind of things and yeah, and don't know whether you all have seen it. I mean, very first cluster, Minuangoda cluster, very first cluster from the Brandex. My goodness, after 1 or 2 days, once the cluster is getting increased and all, I saw like very, not lot of, but I saw few posts, very inhumanistic viewpoint of that post, like they say lots of things related to these girls who worked in the Brandex and of that. But have you all seen kind of that? They are really scared to get positive and doing such sort of things, and criticizing their personalities and characters, kind of that, and especially with the brand bakes, kind of that.
Yeah,
So
it has been stigma now. Like corona is like a stigma for these people. They don't
yeah,
accept. Even if they have a patient at their family, they're like, no, they don't want to say that out. They
they
don't want
don't
to.
want to say that. Yes, exactly, yes. And sometimes they reluctant to go for a PCR ne.
Yeah.
So now in my
And if
area
they
also,
go,
like
they'll be
it's
like,
been
no, actually, I didn't go for a PCR. I just went for something else. They don't tell. We know that they have gone for a PCR test.
PCR
We
and
feel
not
so
telling
shame.
it. Yes, so we can understand them also why they are not telling it, because it's because of the society. Because our society is having a still the blue mind of regarding them. Because we also don't letting ourselves to accept it. ඒක හොඳටම පේනවා when the FB post එහෙම share වෙද්දි related to that brand X workers. I mean, who the people like to have corona and who voluntarily come to me කියලා never. So something had gone through, but of course the person who came and if they are not being careful or careless or doing all the measures inaccurately, yes, of course it's the fault of them, but the other workers are helpless. So still the society is like that. So it's no wonder that people reluctant to accept that also, because now they think like we won't be able to live in the society hereafter, even after survive කියන එක. So majority people's attitude has to be changed. ඒකම තමයි like මොනවාද, even for the mental illnesses also. So this topic has been talking from the like even 1.5 decades ago, but still the same. Okay, වෙනසක් නැහැ. Still the same, because like I remember like when I was a student in my bachelor's, one of my lecturers shares their experiences, and also then after completing my postgraduate and all, then I went for a hospitals to work. So then again I same experience, because people reluctant to come and accept it. And not only mental illnesses, but ADHD කියන එක, which is very common nowadays. So still the parents like they reluctant to come to the clinics, take the and accept it that they are having hyperactivity features, and ADHD is not a big issue, because it is, through activities and through giving some medication for the hyperactivity. So then once the inattentive problem is solved out, so the child is fine. Only thing is he has to go for some kind of behavioral therapies if the child has some kind of maladaptive functions um, related with wrong parenting or sometimes wrong socialization, kind of that. So few things are needed to be done, that's it. It is not some kind of that person has AIDS or something like that, right? So I know as a teachers now, here also have few teachers ne? So lots of teachers they used to say, even like even when I do some lectures for teacher training center. So then even they are also, they do say like, ma'am, no point of like, now we know, yes, there were some times that we also didn't know, but now we know, okay, this child has hyperactivity, kind of that, and child needs to send for a psychiatric and some kind of a therapies, kind of that. But when we speak to the parents, they reluctant to accept it කියලා. So at that moment teachers are helpless and you all can't do, yes. But the thing is, if you find some such things, so if the child is very disturbance in the classroom, so obviously it's unfair for the other children as well as for the same particular child as well. But if the disturbance are keep on happening, I would say write a journal of it, just to take your safe case. Write a journal of this particular child. This is how the child's behavior, and submit it to the management, because I try to convince the parents, they're reluctant. So then these are the difficulties that I've gone through කියන එක. Right. Okay. So the stress. So we go for the stress. So there is a picture also. I hope that gains something to y'all. That picture. Um, so stress is kind of feeling of emotional and physical tension. So the stress. Now this is an example. Mm, right. So you are a kind of a social person. අපි Anne කියලා ගමුකෝ. Right. Anne is a very social person and uses to go out once in a week, especially weekends, and hang around with her friends. And Anne is kind of an organizing person also, works on time. She prefers to work on time and completes a given task on time and just be prepared, not a messy character. So she wants to prepare herself in advance and then she does it, and she wants to finish it before the deadlines and be relaxed. That's her nature, right? So, and also like if we take a sleep patterns, she doesn't wake till midnight. She goes to bed on time, kind of 10:30, kind of that, after having her meals. So, and having a 7 to 8 very quality sleep, and I mean, she's okay, she's fine, right? So then, and also doing her higher studies. So she's having her final exams next month. I mean, this is October, ne? So November, she's having a final exams. Now, for the moment, only three more weeks for the final exam, right? So once now she's working also while studying. She's doing her part-time job. So once she completed her final exam, she'll be permanent at a working place. Now she's a part-time employer, but once she completed her finals, she would be able to join as a permanent employer, right? So now within just since a week she couldn't she really finds difficult to concentrate, which was not with her because she used to concentrate a lot. So now she finds difficult to concentrate and she knows that she has to study also. She finds difficult to concentrate and also sometimes not active, right? And also like always very heavy mood and heavy feelings also. And also she finds very difficult to express what's wrong with me කියන එක, but she finds something different, not with her which was usually, but something different. And her sleeping hours also very disturbance. She finds difficult to fall asleep and sometimes she gets headaches. And even last this weekend, just a weekend, her friends asked her to go out. She said, no, can't, I'm not in a mood to go. And she stays at home but didn't study also, didn't do anything. She was just seated and found fight to concentrate and pay attention on it, but she couldn't, right? And also like now within a few days wage she is getting body pain, especially the around the neck and her shoulders, like that. So is it something usual happens, usual regulation of fan?
No.
Yes.
No.
No.
No, it's not a usual day-to-day regulation because she is the one who uses to go out and kind of a happening person and very enjoyable, social, talkative kind of person. But for this moment, she was not like that, right? So that is something different. So now just assume Anne has already, I mean, done the exam after 3 weeks. Now Anne had done the exam, finals done. So Anne was, I mean, Anne really feel that relief feeling, oh my God, it's done. And the day of the final exam, she texted her friends and say, okay, today is my final exam. So after 3 o'clock, it's done. Can you please come to my college gate? Then I'll want to go and have fun and eat and kind of that and watch a movie and do all sort of things what I couldn't do. right? So that means Anne was back to normal. She didn't go in the same phase, she was back to normal, right? So whatever the phase that she had gone through, all the difficulties, we do say stress period. Stress in a sense, she has tense emotionally tension එකක් තිබ්බා, and physical tension එකකුත් තිබුණා, right? She had both. But that stressful period had gone, had vanished after that particular stressful incident. Once that incident is done and over, her stressful phase also gone. Did it continue? Yes, had it continued?
No.
Huh? After
No,
the
ma'am.
stressful
No.
event, had it continued that phase?
No.
No, it didn't continue. After the stressful, so exam is the traumatic incident, sorry, stressful incident. So once that exam is over, whatever the phase, whatever the symptoms that she had, didn't continue after that. It's just stopped from there. So she was back to normal. So that stress, we do say, whatever the like, we get stress for a shorter period. So the Anne got stressed out for just 2-3 weeks. That's it. So she was worst at the last week before the exam, or before 2-3 days exam. Yes, fine. But that was very short period where she got stressed out, very short period. And after the particular incident, her all the symptoms had gone, didn't continue. So the stress which has shortened for a short period, which lasted for a short period, and which is being ended up after that incident, whatever the particular incident, we call it acute stress. Is it clear? In the next page, there are 2 types of stress. I'm just explaining that. Right? Is it clear what is acute stress now?
Yes.
Okay. What about the others? Huh? Your responding is been less now. That I have noticed that.
Excuse me, ma'am. So the example you gave is for the acute stress, is it?
I'll go for the chronic also, same example, but I hope the acute stress in a sense, within a shortened period, right, we show the tense, emotional tense and physical tense for a short period. And after that incident, whatever the stressful incident done, our tension also done. It's no more, it's not going to continue anymore after the incident. Clear?
Yeah.
Yes. What about the others? Am I making sense about acute stress?
Yeah, miss. So it means like having a stress for a short period of time, is it?
Yes. Having a stress for the short period of time, and also once that stressful incident done. මොකක් හරි incident එකක් ඉඳන් අපි stress වෙන්නේ. ඒක ඉවර වුණාම we are being okay. Right?
Okay, miss.
Right? So the acute stress is very common. Then අපි සමහරලාට before the exam we get stressed out, and before the interview, yes, we get stressed out. That is acute stress. But once the interview are done, okay, fine. And sometimes another our own wedding, මගේම wedding එක දවසට is like we get stressed out. Oh my god, what would happen? I don't know where would I ended up here. So but after that sometimes I would be okay, right? So the acute stress is not long lasting, and also whatever the symptoms are temporary symptoms. But just assume even after that and after that exam, so Anne faced for the exam, she obviously struggled for the exam, but faced for the exam. But even after the exam, now exam is done, but after the exam also, Anne is having sleeping problems. And Anne is having all sort of eating, the no appetite, and also no mood to go out, kind of that. So these symptoms they are within Anne for more than a month, 1.5 month again. It's they are with Anne, right? Even after that incident, so it's they are with Anne. So if we calculate the past period also before the exam, so 2-3 weeks තිබුණානේ ඒකත් ඒ ගත්තාම දැන් මාස දෙකක් විතර she's being having these kind of symptoms within her. She's been living within these symptoms. So that means that stress is being permanent little by little. So this is not good. Acute stress is normal, but this is not good. So when somebody has the particular symptoms related to the stress for a longer time, I would say 1.5 months or 2 months, more than that, so then it deals to depression.
Excuse me, ma'am.
Yes.
So in this, Anne will now suppose she's stressed about the exams, right? So even
Yes.
after, if she has those same symptoms, even after she faced the exam, so that means chronic stress, is it?
Yes. So I mean, like after the exam, also same symptoms happening now for a longer time. So then it goes to the chronic stress. So this chronic stress leads to depression. Right?
Yes.
So once it's chronic, from acute to chronic with whatever the symptoms are being getting worse. දැන් ගෙදර යාළුවොත් එක්ක ගියේ නැති ළමයා පස්සේ පස්සේ ගෙදර ඇත් එක්කත් කතා කරන්නේ. She reluctant to talk with the family members as well. So where she didn't have where she lacking with appetite, so now she really don't want to eat, and she lose her weight also. Now she's skinny, and at the exam period she had only neck pain and shoulder pain. Now she's having all the body pains and frequent headaches also. So symptoms get worse. Right? Is it clear? Acute stress and chronic stress?
Yes.
Right. So then we'll move again to the first page. In the physical symptoms, I mentioned that physical symptoms of stress, low energy, ඒ කියන්නේ පොඩි lethargic mood එක වගේ. Headaches, even headaches, if you are stressed out, we get the back side. මේ neck එකත් එක්ක තියෙන්නේ mid brain එක, cerebellum එක ළඟ තියෙන ඒ ටික තමයි pain එක එන්නේ. Now cerebellum කොහොම මතකයි නේද? I hope you can remember. And also upset tummy. දැන් ගොඩක් වෙලාට exam ළමයින්ට exam එකට යන්න ගියාම lose motion. And sometimes they are getting constipation. මුකුත් නැහැ කලින් දවස්වල හොඳට ඉඳලා, but now I know today in the morning I'm having exam, today I'm having exam, so morning is having a bad tummy and constipations kind of, and gastritis also is one of the symptoms. And feverish, fever ගතිය උන නැති උනත් කොහෙන්ද හැදෙන ගතියක් තියෙනවා. Right? Okay, constipation and nausea. Nausea, what is nausea?
I feel like
I hope
vomiting.
you know. Yes, vomitish, yes, drawing out feeling. Right. And aches කියලා කියන්නේ pain, aches, pains and tense muscles, especially we are getting body aches, chest pain, body aches වලට just write down there are special areas, neck, shoulders, මේ neck එකත් එක්ක බෙල්ලත් එක්කම යන shoulder එකට අර neck එකත් එක්ක තියෙන nerve එකක් තියෙන ඒක තමයි ගොඩක් වෙලාට රිදෙන්නේ neck and the shoulders. Okay. Right, chest pain and rapid heartbeat. Insomnia. What is insomnia? Have you ever heard about?
Inability to sleep.
Yes, inability to sleep. It's one of the sleeping disorder. It is not again a sleeping disorder එකට අත්තටම worst වෙලා නැහැ, but there are several sleeping disorders ne, hypersomnia, insomnia, narcolepsy, kind of that. So insomnia is inability to sleep, inability to fall asleep, right? Not the inability to sleep, fall asleep කියලා දාන්න. And frequent colds and infections. Frequent colds and infection in a sense like every time you feel that your body is very hot and you having fever කියන එක වගේ, but it's not fever, but you feel that you're having fever. දැන් අපිට උණ ගැතුනහම ඇඟින් රස්නේ වගේනේ. We do feel it like that නේ. දැන් මෙතන sometimes we do feel it. දැන් ගොඩක් වෙලා නිදාගෙන ඉද්දිම you can make it like then and then නිදාගත්තාම you feel your body temperature on the bed. අර ඇඟෙන් රස්නේ දැනෙනවා. අනේ වගේ that's also one of the symptoms of stress. And you are losing of sexual desires and appetite, your pleasure. And pleasure කියලා කොහොම ඕනම දෙයක් කියන්නේ enjoyable කියන එක. Right? So this is very important thing where we want to pay attention. දැන් ගොඩක් වෙලාවට stress කියන එක මිනිස්සු ගණන් ගන්න නැහැ. People don't think about ඕක හරියයි. ඕක it's normal. ඉතින් ප්‍රශ්න නැති ජීවිතේ නෑ. There are no lives without problems. Problems are there and and the thing is අපේ ගොඩක් හිතන දෙයක් තමයි yes, it's true. There are no lives without problems. Yes, there are problems. And we have to have a personality to deal with problems. එහෙම කියලා මිනිස්සු හිතනවා ප්‍රශ්න වලට ඉතින් අපට මුණ දෙන්න ඕනේ කියන එක. Yes, we have to deal with the face to the problems and all. But එතනදී like there are ways of, we have to find out what are the ways of dealing කියන එක. ඒකට අපි හොයන්න නැත්නම් කොහොමද අපි healthy ways, right? So we have to find out the healthy ways. මටත් හානියක් නොවන healthy ways මොනවද මේ stress එක control කරගෙන යන්න. So of course we can't run away from the stress. We have to stay and dealing with the stressful situation. But we have to find out the healthy way. What are the healthy ways that I can go? So then if you feel it, okay, I'll talk to somebody and see. If I want to talk to somebody and overwhelm myself, yes, fine. The main point the counselors later, you all have, the counselors having a responsibility, because at this point the person no need to go for a medication. This is just the initial space. The counselors has it, okay, why now? For say an example, if the person comes and say I'm getting frequent headaches and also this is a new place, so I really can't handle this situation and it gets time to adapt to the situation as well. Everyone is new, the company's organization is new, employers are new, the system also new, kind of that. So then obviously the person have got some thoughts. So then you want to find out the thoughts. Okay, so what do you think about yourself? Why do you say that you find difficult to deal? So then if the person come and say, I'm having a doubt, like I'm having a thought that I won't be able to deal with this. I'm not a modern technical person. Here, having all the systems are done with softwares and all, I'm not a modern technical person. I'm a typical, like, outdated person, kind of that. So, if you change that thought of the person, no, it's not like that for the modern technology. Yes, it's updated day by day. So, it is something you learn. It is something you learn how to cook. You learn something new recipe to cook. අපි හැමදාම උයන බත් ටිකම කකා ඉන්නේ නෑනේ. We find out different recipes නේ. අයියෝ මට ඒවා උයන්න බෑ එහෙම කියලා ඉන්නේ නෑනේ. We find out different recipes. We look for the books. සමහරට අලුත් recipe එකක් TV එකේ එහෙම කිව්වම මතක තියාගෙනත් හදනවා. So yes, why can't we change? We of course can change. And we of course can adopt. If we can adopt to a new recipe and eat that, so why can't we adopt to a new system? Of course we can. So through like that, so then we can change the thought of the person and let the person to go. Then he himself change it, and you are not going to change the behavior. You just talk to the person and challenge the person. Yes, why don't you think that you can do it? So the person decided himself, yes, fine, yeah, what, it's not a big thing. I used to do lots of changes in my life. So you make an insight within the person. Have you ever done any changes since you born? Haven't you done any kind of changes in your life? Then he would come across and say, why not? I have done lots of things. After my marriage, I changed my whole stream of, I did study something else and I do something like that. So it's a huge change. You can appreciate it. So here, you can do the changes. You can adapt to the situation. Likewise, you can, as a counselor, you can make an insight within the person. Yeah, of course, you are capable enough to do such things කියන එක. Right? මෙතනදී මේ stress කියන එක අපි ගණන් ගත්තේ නැතිනොත්, if we haven't pay more attention for this stress, you can see the symptoms. Low energy and the headaches. The energy එකක් නැත්නම් වැඩ කරන්න බෑ. Right? ඒතර මොකද වෙන්නේ low energy එකක් ආව ගමන්? So you won't be able to complete your given task on time. And you won't be able to whatever the complete your works for the day, and then it's hoarding. කරපු නැති වැඩ තොග ගහලා දැන් ගෙදරක උනත් අද රෙදි හොදන්න බෑ අයියෝ can't කියලා නෑ ඔක මං හෙට හොදනවා කියලා බින් එකට දාලා තියෙනවා. හෙටත් මේ මට බෑ මෙච්චර තොගයක් හොදන්න පුළුවන්ද? I can't wash this much කියලා තියෙනවා. බින් එක මොකද වෙන්නේ කන්ද වගේ උඩ යනවා. So can't එතකොට so the smelly, sweating smelly, and yes. So even after you collected the clothes for 3, 4, 5 days, and you really don't make yourself to look at that even. තොගයක් තියෙන දැන් හොදන්න බෑනේ කොහොමද? So that would happen. And then even like if you don't have an energy to cook and all, you say no, I just cook 1, 2 curries and rice. මට බෑ තව උයන්න. I can't. ඒ ඔන්න එක හැමදාම අද පරිප්පු chicken උයි. හෙටත් පරිප්පු chicken උයි. So next day also dal and chicken. ගෙදර මිනිස්සු, see they will like, so what's wrong with you? Can we eat? කන්න බෑනේ හැමදාම එකම එක. Right? So aren't there any varieties kind of that? So then obviously this happens for the marriage lives. අපි හිතන්නේ නෑනේ මේක මොකද කියන එක. And සමහරවිට දැන් ඕක ගැන කිසිම අවබෝධයක් නැති වුණාම husband උනත් එච්චර ලොකුවට බලන්නේ නැහැ, හිතන්නේ නැහැ. And they are thinking that person is being careless. කිසිම ගාණක් නැහැ. Being careless, and sometimes they will come into any other kind of suspiciousness matters. This I don't know why, when I go to the office, I don't know what this lady is doing at home. Must be being in phone or chatting with somebody else. So unnecessary problems are occurred. But the real thing is something else. You're being stressed out with something else. ගොඩක් ලාට මේක වෙනවා just after a baby's giving birth, hormonal changes වෙලා, even during your feeding period, sometimes you are not happy with your body shape. Your body shape is like ලොකු shape එකක් නැහැ නේ. ඉතින් එතකොට ඔක්කොම out of shape නේ. So you've been like, what is this? This is only my duty. I just feed the child and wash the child, and that's it. cooking and all. There's no any life without that. ඔහොමම කියලා. I mean, mothers get stressed out. ඉතින් ඒක වෙනවා ගොඩක් වෙලාවට. So the family has a have to have a very good responsibility and some kind of alertness towards the mothers, especially after the birth. There is a condition called postnatal stress disorder. After the condition, in Sinhala nang එකට කියන වැදුගේ සන්නේ කියලා, but the other language I don't know what is that. But in the psychological term is postpartum stress disorder කියලා කියනවා, postnatal depression කියලා කියනවා, same thing. So they are getting that stress because of the hormonal changes. So then ultimately they are losing their sexual desires. ඉතින් මේක ගොඩක් ලාට මෙහෙම වුණාම, so then final එක තමයි මේකට ගත්තේ නැත්නම්, if you haven't get any kind of measures regarding this problem, අන්තිමට වෙන්නේ ඉතින් court එකෙන් තමයි කෙලවර වෙන්නේ. I mean, the families are being separated. The husband is thinking wife is having something else and kind of she's not interesting me, and so then obviously husband goes for going behind another lady. So the family problems are occurred. So stress is very, very important point, not only for the family problems, not only in the families, even any kind of thing. Stress කියන එක තමයි very important factor එක. Because that is a beginning point of all the other disorders. Right? Most of the other disorders, not all, sorry for that, most of the other disorders, depression, anxiety, panic disorder, ඔක්කොටම තියෙන stress එක තමයි මුලින්ම. Right? So why? I have given some reasons for why these stressful situations occurred. So those are general things: death of a loved one, divorces, lose of job, increase in financial obligations, marriage, and moving to a new home or new town, transfers, chronic illnesses or injuries. If you diagnose some kind of a chronic illnesses, especially when I talk about the chronic illnesses, especially cancer patients. So even in Sri Lanka, they have done research for the breast cancer patients from Maharagama Apeksha Hospital, how they are going to deal with stress after diagnosing cancer. So ගොඩක් වෙලාවට cancer patient කියන එක ගත්තාම, even cancer patients, cardiovascular diseases, ඒ දෙකම ගොඩක් වෙලාවට the stress, then once a person is being stressed out, so obviously what will happen, our body is getting weaker. අපේ body එක තමයි weak වෙන්නේ. ඉතින් කන්න බැරි වෙච්ච ගම ඇඟ weak වෙනවා. වෙන දෙයක් ඕනේ නැහැ weak වෙන්න. Once we lose of energy, so then lose of appetite, we won't be able to eat. ඉතින් ගොඩාක් වෙලාවට මේ cancer patients ලා දුර්වල වෙන්නේ, physically දුර්වල වෙන්නේ මේ stress එක නිසා. ඒක handle කරගන්න බැරි වුණාම තමයි physically දුර්වල වෙනවා. ඉතින් they want to have very strength mind. Cancer කියලා කිව්වම හැමෝගෙම death මේ life එක ended up වෙන්නේ නැහැ. There are lots of people who survive from cancer. So yeah, දැන් අර ළඟදිත් අපේ මොනවාද actress කෙනෙක් නේද, සුසන්තා චන්ද්‍රමාලි, so she has survived, didn't she? She's been surviving and almost overcome වගේනේ. So there are lots of people like that. So it's not kind of that. Even the heart diseases are also the same, and even the other diseases same. Whatever the disease you are having, stress කියලා කියන්නේ stress එක තමයි ගොඩක් වෙලාට අපිව weaken කරන point එක. And the emotional problems, if you have kind of then long පොඩි කාලයක වගේ එහෙම නැත්නම් like හිතන්න you are being stressed out for some period, depression, you are being in a depressive mood for some period and you've been recovered and all, but again like after even though you recovered after kind of few incidents or kind of that, so you may get back to the depressive features as well. එතකොට ડિප්‍රෙෂන් එක එන්න කලින් එන්නේ ස්ට්‍රෙස්ෆුල් සිටුේෂන් එකක් තමයි. Right? Any questions so far? Yes, can you all hear me? Any questions so far? Right. So the other one is, yes, according to the National Institute of Mental Health, they identify, the types of stressors, how the people, what are the types of stressors, routine stress and sudden stress and the traumatic stress. Okay, the routine stress in a sense, like as a routine basic, like you're being stressed out, you're having homework or projects to doing. So even like the සමහරගේ routine එකක් හරි පුරුද්දක් exam එකක් ලඟ වෙච්ච ගමන් you're being stressed out, but after that you're okay, but you yourself know it, okay, my god, that I'm going to stress out and I'm getting all sort of things before my exam. So it's been usually happens. So with the time, sometimes you may be alert on it and you know, okay, then you try your best. No, it's not like that. Whatever the things happen to me, I just go for the exam and do. Okay, you try to control it also, right? And the other one is sudden changes, like sudden death of a family member or sudden transfers of your job environment, or um, you have to say goodbye and go for another country or whatever. Sudden changes happens and you get stressed out or job loss or something like that. And the other one is traumatic stress. So traumatic stress in a sense, whatever the extreme traumatic incident happened in your life, not that something you overheard, right? This sudden stress එකේදී, but something that you overheard also could be happen. You could be stressed out with the something you overheard. දැන් ගත්තොත් එහෙම this East attack. So this was some real experience. One of my students shared it. She herself didn't, she didn't go for that church, Katua Piti, I guess, for the East attack, 21st of April. She herself didn't go for the church, but she's very close by, and also she overheard at the point she didn't realize it's a bomb blast or something, but she overheard that sound. But then she overheard all the experiences and just saw the experiences. That's it. Discovery part. Not she'd been over there and experienced lively experience එකක් නෙවෙයි. Right? But then she mentioned it like, after that I couldn't make myself to go to that church still කියලා. එතකොටත් වෙලා මාස දැන් අවුරුද්දකට කිට්ටු ඉතින්. So then she said, I couldn't make myself to go. It's my church, but මට ඒකට යන්න බැහැ. I feel scared like that. So that is something she overheard, not this lively experience. But the traumatic stress is not like that. You yourself lively experience and then you get it. It says after a traumatic stressors, it's been developed to a post-traumatic stress disorder. PTSD කියලා කියනවා. Right? Okay, any questions? Yes, is it clear for y'all?
Yes.
What about the others?
Yes, ma'am.
Yes, ma'am.
Okay, this is not something related to that, but educational degree and psychology degree, is there any possible career? Hmm. Even in the teaching side now, if you are doing educational degree or something, you can go ahead with masters. Educational psychology, there are masters with educational psychology, with the education and psychology linked together. So then, I mean, you can go ahead with the teaching field also as a uh, whatever the administrative field, or kind of a sectional head or headmistress, kind of that. And also with the academic field, because in lots of schools they have vacancies for the academic officers or the academic executives to related with curriculum syllabus and all, because in the educational bachelor's එක කියන ලොකුවට කතා කරන්නේ bachelor of education එක just for teaching. But if you go for masters of education and or educational psychology, it linked with administrative part and also with the academic instructors. So you all can go as academic instructor. So if you done with a very good masters with the research base, so then I mean masters, and if you go ahead with MPhil like that, you can work as a lecturer. So those are the ways. But in the psychology degree, so I would say like after you are doing the psychology degree, you can go ahead with postgraduate diploma, because then through postgraduate diploma, even without masters, if you go ahead with postgraduate diploma, if you're really interested in counseling, you can go ahead with postgraduate diploma in counseling and psychology, like that. Then after that with the practices, but before coming to mona masters monawa tibbat, without the practices, I mean, it's difficult to practice. ඒකත් අපිට තේරෙන්නේ නැහැ ඇත්තටම මිනිස්සුන් අමාරුවේ දාන්නත් බැහැනේ. So practice at least 1 year. ඕන තරම් දැන් තියෙනවා, there are lots of places volunteers අට practice කරන්න. So you can go and practice with them. So after practices, yes, there are lots of opportunities for counseling then. ගොඩක් තියෙනවා. There are online webarians තියෙනවා counselors ලට. There are lots of places for the counselors. But when you go for practices as a counselor, link with the psychiatric. තනිය මොක කරන්න යන්න එපා. මොකද ඒ වගේ හරියට පඬිත් වැඩ කරන්න ගියාම හරියට අමාරු වෙනවා. මිනිස් clients ලත් අමාරු වැටෙනවා, counselorත් අමාරු වැටෙනවා. So you can go ahead with the psychiatric. The psychiatric කෙනෙකු contact කරගෙන then you can go ahead with the counseling. But I think I mean better to go for a masters and then just I mean qualified with the whatever the relevant field. After BSc and counseling, for my opinion, I would say bachelor's not enough, because ඔගලන්ට තව ගොඩක් ඉගෙන ගන්න තියෙනවා ළමයි. ඔය මේක with මේ පොඩ්ඩ විතරක් නෙවෙයි. Not that I can. Still we have to study. No, I have done my MPhils and all. But even though like I feel like no, it's not like that I have to. I have want to study more කියන එක. එතකොට bachelor's කොහෙත්ම enough වෙන්නේ නැහැ. Because why I am telling you all this, we are going to dealing with human being, and especially people who have different difficulties. normal අයත් එක්ක නෙවෙයිනේ. දැන් ටීචින් කරන්න ගියා, okay fine, ඒ බබාලා normal. So අර ඒ ටික ඉගෙන ගත්තාම අපිට ඒක කරන්න පුළුවන්. වෙන job එකක් වුණත් we can do it now. Once we do the IT and all, bit එකක් තිබුණාම bachelor of IT, okay fine, we can go ahead. But there we are dealing with files, documents and the softwares ඕවානේ. හැබැයි මෙතන එහෙම නෙමෙයි. We need, and everything is being updated. අපි ලෝකේ වෙන දේවල් හොයන්න දකින්න ඕවා කරන්න රිසර්ච් එකක් දෙකක් කරන්න ඕනේ. Then only we being like getting updated. And ගොඩක් වෙලාට bachelors වලදී දැන් DSM අපි diagnostic manual එකක් refer කරනවා. ඒක ලොකුවට refer වෙන්නේ නැහැ unless it goes for the clinical. ඉතින් ඕක refer කරන්නේ නැතුව අපිට එන දැන් ගොඩක් වෙලාට වෙලා තියෙන දෙයක් තමයි, I'll just share this one. Once yeah, one of the client came to our hospital. Mm, so it's way I don't want to I really don't want to share where from he came and who's the counselor or whatever. But the pathetic situation there is that person had been treated for more than 4 years for anxiety, right? But no, I mean no changes happen. ඇත්තටම එහෙම ලොකු change එකක් يعني වෙන්න ඇති වෙන්න බෑ. There have to be some change. අවුරුදු 4ක් එකම ටිකට බෙහෙත් ගන්න අවශ්‍යතාවයක් නැහැ. Then after that, so he joined it and she ගෑනු කෙනෙක්, so came and කොහමරි history taken අරගෙන, so I'm the one who did the history also, then was taking a history, and then the lady came across with so many prescription and say මම බෙහෙත් අරන් තියෙනවා kind of that. So then I mean show that to my psychiatric also here, that is කියලා නෑ anxiety කියන features නැහැ ඇත්තටම. Anxiety features තියෙනවා, she has anxiety but she has more than that. So then when we go ahead and ask that she doesn't have anxiety, she has bipolar. දැන් බලන්න අවුරුදු 4ක් වැරදි ලේකට බෙහෙත් අරගෙන කවුන්සලර් උත් ගිහිල්ලා මොන අපරාධයක්ද? So මුල කාලේ බලපු හිස්ටරි එක ගත්තාම ඒ මනුස්සයාට තිබුණේ පොඩි ප්‍රමාණයක් symptoms. හැබැයි අවුරුදු 4කට ගියාම නැති ලෙඩත් හැදිලා බයිපෝල් එකට බෙහෙතුත් නැහැ, ඒකත් තවත් වැඩි වෙලා. So ඒකයි කියන්නේ I mean it is not a small පොඩියට ගිහින් කතා කරලා හරි යන්න කියලා එහෙම කියන එකක් නෙමෙයි. This is a very big thing to do. So I mean I would say you all have to study a lot. BSc එකක් කරලා at least doing a postgraduate diploma at a qualified place. Go for a qualified place and do a postgraduate diploma or something, and then start to practice after a practitioner, and then you can continue your career and also your studies. Okay. Binath, I'm not from Colombo. I'm from just beyond Vattala. Of course, I'm just under curfew area, having few tested positive corona people also around myself. Okay,
Even one
I
of my,
hope. Sorry.
no, ma'am, even one of my auntie also tested positive corona.
Oh my, seriously.
Yeah, and
I'm wishing her
whole
speedy
family,
recovery. How was
like,
the situation of her?
she's a bit fine now. You know that fussy doctor, the news was spread all over the. I don't know whether
Sorry, it's not clear for me.
Dr. Fasiha.
Huh?
She's the one. Now
Okay.
she has tested negative now,
Uh-huh.
and the servant they have tested positive. They're in IDH.
Seriously.
Yeah.
You are from where?
Mavanella.
Mavanalla. Okay.
Yeah. Even my father also tested PCR, but there is nothing
How was the
serious.
result?
Yeah. No,
Negative
he's
then.
negative. Yeah.
Okay. Yeah, so I know like this situation, like we have to accept this situation now, can't help. It's go beyond the control. You think I don't know whose fault is this. Fault anything. So however, be at home. I don't know whether some of you all may be having curfew. Even though you don't have curfew, please be at home and try to get the things like without going to the gathering places, minimize the gathering places. So can't help, and whatever the thing you have to do is strengthen your immune system. That's it ඉතින්. දැන් තියෙනවා අපේ දේශීය දේවල් ingredients ඉතින් කොත්තමල්ලි ඒ වගේ කියන ඒවා steam කරන්න, hot water බොන්න ඉතින්. That's only we can do. Oh, yes. We hope for the best.
The situation is out of control. Ne?
Of course, yes. Now the situation is out of control.
Mm.
Can't help it in now. I don't think whether they impose curfew or whatever that they would be able to. They would have done it earlier, not this time. But yes, we can't take the government decisions.
Now they are
Whatever they
being
say.
careless.
Yeah, I think. And now Sri Lankans totally forgot that, I would say, because like till the brand X it's been come out, so people were like, there were some few people in the public areas without mask. People
Yeah,
didn't care. I mean, they also just forgotten about the incidents. Ah, okay, no more corona. Sri Lankans get spaghetti easily, just for only three weeks again.
yeah.
So that's all Sri Lanka, I think. Until, but the thing, you have to maintain personal disciplinary now. That's the thing. Who the people maintain the personal disciplinary would survive. The සමහර මිනිස්සු නෑනේ අහන්න නැහැ anything. They are being real pandita and no, we won't get it. එහෙම කියලා I think එහෙම තියෙනවා anything. But yes, acknowledge your family members also for everyone. So I'll also add all of y'all in my prayers. So yes, be safe.
Okay, ma'am.
Okay, so if y'all do y'all have any questions, any more doubts? Right. So then we'll continue with the depression from next week. Right. I talk about the assignment. I haven't discussed that matter with the college. I'll get back to y'all next week. Okay, the date is fixed, but I haven't decided the time duration of it. I try my best to take 3 hours at a stretch. So we'll see. Right? Okay, girls, then stay safe and see y'all next week.
Thank you, ma'am.
Okay, ma'am.
Thank
Thank
you, ma'am.
you.
Yes.
Good night,
Bye, good
ma'am.
night.
Bye.
Ma'am, good night.